Hello and welcome to the program, The Big Talk on Global Television. My name is Anthony Momoni. Welcome to today's episode, the very first day of December 2023. And we're in with a shout as we reach the business end of the year 2023. On today's edition, we'll be focusing on the health sector, a very important sector in our national lives, and lots of issues and a lot of comments as regards the poor allocation, talking about budget allocation to the health sector by the federal government, and this has also led to very interesting developments in a couple of weeks ago. We had some very disturbing stories as regards the Lagos State University Teaching Hospital, where 5 wards, which had as much as 150 beds, was shut down due to lack of manpower, talking about brain drain in the health sector and other issues. But today we're looking at the managed care, is what we're looking at as our rider and delivering of quality healthcare services. And so what it means, we'll be looking at the issue of health insurance scheme in the country, and that's specifically falling on the HMOs, the health maintenance organizations in Nigeria. How well have they done? Statistics by an online platform in Germany did rate Nigeria as 157th best healthcare service in the world. Very poor, 157. And there's also a statistic that says 5% of Nigerians have health insurance scheme, while 83% of others pay from out of pocket. All right, on today's edition, like it's customary, we get the finest minds in the sector to help us look at this very interesting talking point. We have Mr. Abraham AMEH, who is the Sales and Business Development Manager of one of Nigeria's health maintenance organizations, talking about Health Spring Limited. Mr. Abraham, nice to have you in the studios.
Thank you.
All right, so let's look at a health insurance scheme in Nigeria. It says that 5% of Nigerians have health insurance, while 83% pay from out of pocket. What are the main challenges of delivering quality healthcare services to Nigerians?
Thank you very much. I think this topic is very important. As we look at the challenges beseeching the health sector in Nigeria, as it has to do with the HMO, we have a number of issues ranging from one, quality staff and professionals in the health sector. Nigeria, presently, we are suffering from that of qualified, skilled professionals, ranging from the doctor to the to people who are professionals in other fields. They are very, very short, and a lot of them travel out of the country due to inadequate remuneration. And besides that, we have a problem of inadequate funding by the government. And this has also contributed to the brain drain. Also, we have a lot of problem of infrastructure. Most of the healthcare facilities are dilapidated. For instance, the national healthcare provider, the National Hospital, a visit to National Hospital is gives.
Okay, let's look at the issue of managed care now for HMOs. We know that secondary and tertiary healthcare services are domiciled in the urban areas, while primary healthcare centers are scattered in the rural areas. How well would you say HMOs have done in order delivering quality healthcare services to Nigerians at the rural areas? Or would we say the HMOs are basically more for the elites?
Thank you very much. In Nigeria, presently, we can say that the HMO sector has not really done well. Just like you rightly asserted in your introduction, we discovered that statistics today, especially in 2018, there is a survey by Statista which says that only 3% had been covered by HMO, especially those that are in the urban centers. And you discover that among this, and in 2023, as today, we have only 5% coverage, which include 3% of women, mainly in urban sector, and 1.9% of men, 3% of men in urban sector, and 1.9% of women. Then the 0.1% of others, and they are mainly urban centers. The reason is because most of healthcare facilities are not present in rural areas, and beside that, we discovered that poverty and the general
okay, talking about poverty now, let's look at the HMOs. Wasn't that one of the reasons the HMOs came into the picture, the fact that the HMOs have wider network of healthcare providers? So why is it that they're not living up to the mandate of providing healthcare services for Nigerians across board, since they have network of healthcare providers?
The reason is not far-fetched. Though the government has provided the platform somehow, but there is no political willpower to enforce it. You discover before 2022, when we have the NHIS, the law was there, the edit was there, but the enforcement was not there. It was only last year, during the time of the last government, that the law was signed, the edit was signed into law that everyone should be covered. And because there's no willpower to enforce this law, it has...
To enforce it by who? Who is supposed
by the government.
Okay.
And this has drastically led to the poor performance. And also, there's no advocacy, there's no awareness.
Who is supposed to do this awareness? Shouldn't it be the HMOs in collaboration with the National Health Insurance Scheme doing this awareness? Because we know that HMOs have enrollees majorly from the government sector, and the government pays for these enrollees. How come there's this issue of you're entitled to this coverage and you're not entitled to this coverage? It still comes up.
Thank you very much. Yes, the HMO are doing their bit in publicizing the importance of coverage, but more should lie on the shoulder of the government and non-governmental agencies. If the government enforces it or provide a platform to enforce it, and not only enforcing it, also making the fund available, yes, the spread will be fantastic.
When you say the funds for what now? Because we know that government pays directly to the HMOs in terms of the enrollees under your scheme. Well, let's just look at the fact the facilities now. There's what we call the quality assurance drive, where you go to check hospitals to be sure they are up to standard, they meet standards, and the issue of out-of-stock drugs. When patients go to these hospitals, these providers, and they're told these XY drugs are not there, they have to pay from their pocket, which is against the scheme. Why is the HMO not trying to solve that issue?
Thank you very much. Yes, number one, most of the healthcare providers available are few and are grossly unfunded.
But the HMOs are the ones who pick these providers. So
yes,
why do you pick providers who cannot deliver the goods?
We cannot build, the HMO cannot build all healthcare centers.
But so they decide, they have contracts with these providers, this yes. Healthcare. So why would you have a contract with a provider you know is not up to scratch, doesn't have the quality in personnel and the drugs?
Yeah, of course, we do accreditation.
Yes.
To select the few that meet up with the standard.
Sure.
Now, we also supervises them to ensure that they deliver. But because of the percentage of the qualified or the percentage of the good providers we have, which is grossly inadequate for the teeming population of Nigerians. The problem is still there, the lag is still there. So HMO do their best to monitor their activities and also pay them for their services.
Okay, let's now look at recently the present administration had said they are going to do some refurbishment of 774 primary healthcare centers in the country and also provide lots of turnaround for the health sector. How much is the managed care industry, the HMOs, involved in the recent bid by the federal government to turn around the health sector? And would you say this present administration is carrying along those in the managed care industry?
Well, the fact is that the present government seems to make a lot of efforts or promises. So, but we are praying and believing that they will put these promises and policies into real practice, into real action. Presently, the HMO are doing their best to ensure that with the little resources available to them, this dream comes true.
Okay, on the part of the providers, the HMOs themselves, how has it been for them meeting up with their targets, being able to pay their, their providers, and also being able to meet up their other money for their companies in terms of profit margins? How has it been, especially at this time when inflation is on the rise?
Yeah, the inflation actually has had its own toll on the profit margin, which is very, very slim. But the HMOs have been trained to manage the meager resources available.
Is it true to say it's really slim when we know that some enrollees do not visit these healthcare providers in a year? And so, but the HMOs are still paid regardless of whether there's a visit by the enrollees or not?
Yes, actually, while some do not visit, we have those that utilizes the premium. In fact, the majority maximize the opportunity, and the premium paid is not commensurate with the care they receive. So it is the work of the HMO to ensure that quality care at an affordable rate and ensure that all enrollees get the best of care.
Okay, let's, as we begin to wrap up, let's look at the issue of brain drain and lack of, like you rightly pointed out, lack of skilled healthcare professionals, the doctors, the nurses, the lab attendants. How bad is the situation, and how far do HMOs go to get the best hands, or they still rely on the general hospitals, referrals, and just take us through how bad the situation is?
Yes, it's really bad because in the past 10 years, Nigeria has experienced serious brain drain as a result of poor remuneration of skilled workers, and that has really affected the health sector. Now, the HMO as a sector has made frantic effort to source the few available good hands, skilled workers, skilled force.
Where do they source them from now?
From the society. And they pay highly for this manpower, skilled manpower.
Okay, let's look at the rivalry between the HMOs. I know there's this kind of rivalry where certain HMOs seems to have a larger chunk of the enrollees in different government parastatal. And for your HMO, who is among the new ones, because we know we've had about 60 plus HMOs before the last 5 years, how would you balance the new HMOs on the block now and those HMOs who really have lives from government establishment?
Yes, actually, the old HMOs that started the
scheme, the National Health Insurance Scheme, yeah.
what was obtainable then was that the National Health Insurance scheme then seeds out
lives,
yes, to them, and
okay.
that accounts for the large number of enrollees they had. But presently, there is room for competition, and this has brought a healthy benefits to both the numerous enrollees, the enrollees, and then the HMOs. Now, the competition has eroded monopoly. And you know, when there is room for competition, everyone tries to give good services and make effort to impress their clients. So because of this competition that is on now, most of the organizations that their lives were ceded to the old HMO now are retreating back their lives to the newly established HMO because they tend to give more.
All right, let's look at the corruption within the managed care. We know at times where enrollees go to hospitals, they do not necessarily take that service, but they pretend to take that service. So that's when we talk about the authorization code given by HMOs for service to be delivered. How has it been easy for HMOs to tackle the issue of corruption between providers and enrollees trying to defraud the HMOs?
Yeah, in Nigeria, corruption has eaten deep into every fabric of the society, and the HMO industry is not spared. However, currently, the HMO do what we call quality assurance, and quality. The quality assurance is a measure of check and balances and vetting of claims.
Okay, all right.
That helps to curb this room for defrauding either the enrollees or the HMOs. So from time to time, we send our doctors and other professionals to visit these providers, look at the bills, and come and then pick out some of these errors and some of these.
Okay, let's just wrap it up with the question I have for you is for HMOs now. What in the next a few years, what are your expectations for HMO and the issue of health insurance in Nigeria? Are we moving forward, or you think?
Yes, I think we are moving forward. With the recent bill being passed, enabling every establishment with at least five employees, to making it compulsory for them to have health
insurance.
Health insurance. This will go a long way to enhancing coverage, the universal coverage, which NHIA currently advocates, and it will give more room for assessing of care, and I think it will make it better than we had seen it before now.
All right, in case you just joined us, we've been talking about managed care in Nigeria. Delivering of quality healthcare services, what our focus has been. We have the business development manager and sales and business development manager of a Health Spring HMO Limited right here in the Federal Capital Territory, talking to us about how, the issue facing the managed care industry in Nigeria, how brain drain and other factors have made health insurance really difficult in Nigeria. My name remains Anthony Momodu, saying thank you for joining me on today's episode. Let's do this again tomorrow. Good evening.